about the fact that the viruses are tagged A, B, C, D, and E. Two of them cause acute inflammation, whereas three of them cause chronic inflammation. The acute inflammation means inflammation that lasts less than 6 months, whereas chronic inflammation means inflammation lasting more than 6 months. Now, those definitions are just duration based, and it has nothing to do with severity at all. So in most instances, the ones that are of major concern are the chronic ones, which are the ones that have long-term complications that could actually lead to death in most instances. So the B, C, and D, hepatitis B, C, D, A, I'll come again, the hepatitis B, C, and D are the most common ones that cause chronic inflammation. You and I would know more about the B being more prevalent in Nigeria and in most parts of the world. C is also important, but most predominant in terms of importance of care within the developed countries, Western world and Japan and some other places. But then it is important to note that it does not mean that C is not important in developing countries. There are actually more cases there as well in terms of numbers. So we're having quite a number of issues with that. Okay. I guess you would want to know about how big this problem is. Yeah. So let's take one, because it's quite difficult to discuss all of them at the same time. So which one? I'm sure you would talk about B.
B.
Very good. So let's talk about B. Globally, in the whole world, about 2 billion people are estimated to have been affected in some way or the other by hepatitis B. So it's quite a significant problem. Of that amount, about 350, sometimes approaching 400 million people are chronically infected. In other words, if you take the sample of the world, wherever you go, that amount of people are affected with hepatitis B chronically, meaning that they have some evidence of the virus circulating in their bloodstream. If you now come down to the countries that are mostly affected in high amounts, Sub-Saharan Africa, Southeast Asia, and areas of Mongolia are most afflicted by hepatitis B. Now, if you go down to Sub-Saharan Africa, there is a huge population of hepatitis B patients in Western Africa. Now, narrow that down to Nigeria. It is estimated, I would say estimated because the statistic is not very great, but the national surveillance from the Nigerian Health Ministry estimated that about 20 million people are carriers of hepatitis B in Nigeria. So if you take the population of Nigeria of about 180 million, if you count 10 people, one person has hepatitis B. It will shock you to know that not many people know their status. And so they go about it, and people are getting infected and may not even have been protected at all, whereas there are systems in place to help support patients.
Okay, with this, I think we will now look at the possible cure.
Okay.
Or possible, okay, let's look at, prevention before cure. I think prevention, right. How do we prevent it?
I'm sure, yeah, Sunday, there are lots of things that people may actually get confused about. First of all, I will try to redress your question a bit and think about how is it first transmitted? Because if we know the transmission, then we will know how to prevent it. Okay? And here I will try to solve a problem, because a lot of people, when they hear about sexual transmission, they think that it's the most common form of transmission of hepatitis B. No. In the developing country, such as Nigeria, the most prevalent way by which hepatitis B is transmitted has been in childhood. In other words, from a mother who was infected may have passed it over to the child, okay, without the child knowing anything. So the child may not have done anything, but in utero, the child was given a disease before the child was born. Also, children playing with each other and cutting themselves with some sharp objects may get the transmission of this virus. In some way, these children also can actually share things like household equipments, making their nails with razors that are shared, or brushing their teeth with shared in a family sense. And so people then get the infection from each other because it is a blood product-based virus. The other part is the sexual route, which is really not very common, but does occur, especially in the era of HIV/AIDS. So more patients are getting transmitted that way. In the developed world, yes, the sexual route is very likely. But let's go into the historical part of this virus. It was discovered in 1965 by an Australian scientist, Dr. Blombeck, discovered that, and it was first called the Australian antigen. Okay, from that period, of course, not many was known, so people were getting transfusions of blood. They were giving blood. If you went to hospital and you needed blood transfusion, you were given blood. It wasn't being screened. So a lot of people who got blood transfusion before 1992 may have actually been transmitted hepatitis B without knowing. And so it was from 1992 that the screening, mandatory screening for hepatitis B from blood before transfusion was implemented in health delivery systems. That was when the transmission of hepatitis B became a bit lower. Now, why are we saying all this? The importance is buttressed in this point. Hepatitis B is not an innocent disease, okay? A lot of chunk of people may not even realize the side effects or the long-term damage, but in a particular proportion of patients, about 20 to 30 years from the time they were infected, they have a tendency to develop cirrhosis. Now, cirrhosis is when the liver has become replaced by a fibrotic tissue. In other words, a scar of the liver that no longer produces the benefit that it should to the body. And that way, the system shuts down. And of course, that's when swelling of the belly comes, and swelling of the legs, and eyes becoming yellow, and pain, and so on, and wasting, and people die. Or if after long term, they then develop cancer as well. And so it kills by the process of developing cirrhosis and cancer, okay? Now, those are the ways, and that is the importance of hepatitis B. How do you prevent it? How do you prevent the transmission? One, if you know the most potent way to prevent hepatitis B is by vaccination, okay? If you know that you are living in an African setting and you are at risk of infection, that is, if you live with a family member of yours who has the infection, then it would be relevant to go ahead and get vaccinated. That way you're protected. Okay, the vaccination protects in almost 100% of those who receive it. Two, do not share sharp objects or intimate objects that have a tendency to expose blood, that would be exposed to a wound surface that would expose that virus from about getting into the body of an uninfected person. Three, if you have to get a blood transfusion, ensure it has been screened.
Please, even with vaccination, even when
if you're vaccinated, if you're vaccinated, you are protected. Okay?
Okay. Okay.
It is the vaccine produces cells and antibodies that will attack the virus when it gets into your system and annuls it so that the infection does not get established at all. So even if you are vaccinated and you get exposed to these things, you are not at risk of being infected by hepatitis B. So vaccine is very, very important. Not only is it important in protecting against the infection, it also has been shown to reduce the incidence of liver cancer. Okay, so it's very important mode of transmission. So I did discuss about if, of course, for partners who are married and if the partner is not yet on treatment and the other partner is not yet vaccinated, of course, the use of barrier methods such as condom and so on would be important in preventing the infection, the infection of hepatitis to the uninfected person. But of course, if you are cohabiting as a partner to each other, and what the other partner who's uninfected has been vaccinated, you're safe to go ahead and consummate your marriage, and there will be no issues about that. Obviously, I believe the next question would be, can a father pass the infection to an uninfected child?
Yes.
So that is
Through the mother.
a common question that comes across. Now, research was done in Taiwan, and it has demonstrated that that is possible. And it is only possible not because of transmission from the spermatozoa. No, that's not the case. It's actually from the use of household items. So it's about the use of, like, razor blades or some kind of sharp objects that the child played with and got into it and so on. That is if the child did not receive vaccination at birth.
Vaccination. Okay.
So birth dose vaccination is very important. And of course, pregnant mothers who may be infected, when they are going to antenatal care, they also need to be seen by a doctor who will screen them and determine whether they need to take some antiviral agents prior to delivery and at delivery to make sure that the baby also gets vaccinated. Those are the ways by which we can actually prevent the infection in a large way.
Okay. Doctor, thank you very much for this. We would like to know maybe the clinical approach to monitoring. I heard you talked about monitoring. At what stage do you monitor, and how do you effectively monitor a patient who has hepatitis virus?
There are established guidelines, which I would spare you going through the details of it because these are robust and they require a lot of resources to look after. But the World Health Organization has a simplified way by which patients with hepatitis B should be followed up. Most people will be diagnosed incidentally. Perhaps they've just gone for a blood test or so they went to donate blood and it was discovered at the point that they were positive. At that point, what the patient needs to do is to be seen by a specialist who looks after liver diseases. They will carry out additional tests. If, for example, at the beginning, at the time of diagnosis, it has been shown that the liver has become cirrhotic, in other words, it has become replaced by fibrous tissue, then you don't even need to do more tests. All you can do is to look for complications of the cirrhosis and start treatment without doing viral load and anything, just start treatment, okay? They will do that. The specialists will also, for those who do not meet the criteria to start treatment at the time of diagnosis, they need to be followed up. And the follow-up here is ideally every 4 months. Although I know in developing countries, it can be done every 6 months. It's much easier because of distance to hospital, transportation costs, and also investigation costs for patients. What would the doctor be looking at? They'll be looking at changes in the number of viral particles within the blood. The second thing they'll be looking for will be, are there changes in the liver enzymes? Now, these enzymes are usually not within the bloodstream, But in a slowly damaging liver, the enzymes are released into the bloodstream, and so they are raised. Okay. The third thing is, are there any nodules forming in the liver? Nodules that may suggest cancer. So an ultrasound or a scan is done at each of these periods. And with that information, the doctor can go ahead and think of, okay, one can be treated or not treated. Now, at diagnosis, 1/3 of people will be qualified for treatment. At follow-up, majority of people may never need to be treated because they are having what is called carrier status. They do not qualify for treatment because the virus is dormant. It is not actively dividing. If it were dividing, then you can use the medication to interrupt the process of the virus from multiplying, and that is the way you can actually truncate the process of damage to the liver. But the drug will only work on a substrate. So if the virus is not multiplying, it is a waste of resources to go on a medication at that point. So, and the follow-up is for a lifetime. I must say that this is not a very good thing, but it is for a lifetime for the safety of the person and to make sure that the complications are caught right on time so that the patient is prevented from deteriorating.
All right. Thank you very much, Doctor, for this enlightenment. I know many Nigerians that will be reading this will be so grateful for this. Let's look at the awareness, the level of awareness in Nigeria, particularly.
Yeah.
Do you think that the government has done enough in the area of awareness? And what will you suggest to the government of the day?
Yes, I think the parameters to assess whether the intervention of the government has been robust are difficult for me to fetch out from the literature or to find out on the net. What I can say clearly, however, is that there was a storm gathering just before COVID came on board. And the Ministry of Health was actually trying to establish a system to quantify as well the number of cases and also to look at the importance of this disease so that they can actually bring out a national mechanism to control it. However, you and I know what COVID has done. It took away a lot of the resources that the government had. And so not much has actually happened in that regard. But it is hoped that with the slight improvement in health resources and the lessons learned from COVID, a lot more people will be doing this. And that is the reason why there has been a proliferation of traditional drug vendors, people who claim they have cures for hepatitis B, and they will come to someone, especially when they hear me, for example, especially saying there is no cure, but it can be treated. They believe, they'll come and say, okay, look, this is all bollocks, you're lying. We can cure it. You come to us, we will give you treatment, you'll be cured. And it is based on no sound scientific evidence at all. And a gullible patient who has no idea what is ongoing will go and lose their resources. Of course, a few of them may survive to come and say the stories, but a lot may die. So those who have gone there, in the sense of being cured, may have even died in the process. So we don't even know the stories ongoing. And there has been no evidence that these people have undergone a robust system registered with the drug regulatory system to make sure that they are actually tested or their products are validated. And so a lot of these things have flourished because of this poor and or low level of national engagement in this area. So I believe that the success of any government and any health intervention for hepatitis B will actually reflect how well any national program on control of diseases will do in Nigeria and beyond. Because without that, you think about it, 10%, at least 10%, so 1 in 10 persons, that is definitely an endemic disease that is worth the time of anyone, and it's also damaging people. A lot of people have died in the prime of their lives. Tell me which family in Nigeria has no a case of hepatitis B. Tell me. You almost everywhere you turn to, they will tell you who they know somebody who died from this condition. And it's such an important thing. So why is there no much in terms of the HIV clinics that we see around? We don't have any of such things. No hepatitis clinic. There's nothing like that. Yet there is a flourishing of signposts. I believe you're on the forefront, and you can show me evidence of signposts all over the places. So people saying you can be cured. I have YouTube channels here. And in these channels, I see people come around and they start thanking some unknown doctors about curing them for hepatitis on my channel, which is surprising. So that is the summary of it. Is something being done? Yes, there is. Is it making an impact? Not programmatically. All that it is showing us is that there is a body language that the government is interested, but whether that is being transmitted into a palpable intervention is what is left to be desired. We don't know yet. We are watching.
Doctor, what is really impeding cure? What is preventing the world, so to say, to really provide a cure for this hepatitis? Now, look at the speed with which they were able to produce this vaccine for COVID-19. One would expect that after so many years of this ailment, that a cure should have found for this disease. Why is it taking this long to provide a cure?
Thank you very much for that question, Sunday. Clearly, the concept of cure that is understood by the community is different from the concept of cure that we as physicians define. I will tell you that many people would wish that hepatitis is like malaria, where you go, have a test, it's sent positive, then you go after treatment, you're tested and you're told negative. But that's not the case. It does happen. Don't quote me wrong. There are a few cases that may actually test negative when you have given them treatment. But that is not the rule, and that is not the target of treatment. This is the reason why it is very difficult to cure hepatitis B. When the virus comes into the body of a patient, it goes into the liver. And then it integrates, that virus integrates into the genome, that is the cell, the nucleus, where the DNA, which is where the life of the cell is. And then it interlinks within, it intermingles within the substance of the cell, and in such a complex manner that even when you clear the virus from around the bloodstream and around the liver cell, that integral part of the virus remains within the nucleus. It is called covalent, in fact, let me put the terminology this way, cccDNA. It is, I will save you the terminology to explain that in detail. But what that means is that there's a real covalent linking and tightening of the DNA within the nucleus in such a complex manner that it is very difficult that when you clear the systemic circulation, some of that after some time will just show up from nowhere. And it will then remain in the system. The good news is that with good treatment, you can actually keep that at bay. Although in a few population, that can have a tendency to actually manipulate the cell to the point that cancer cells can develop there. But that is the reality. There is a strong relationship between the number of virus circulating in the blood and cancer. So if you don't have large amounts of the virus in your bloodstream, then cancer of the liver is rare.
Okay.
I think that's how much I can explain
Yeah.
the
Thank you
difficulty.
very
But
much.
there is research work.
Thank you so.
There's still
Thank
some
you.
research work ongoing,
All right.
with
All
the
right.
hope that we can have a breakthrough on how to tackle, that very difficult covalent linking of the virus within the nucleus. Now, if we compare the speed with which the vaccine for COVID was found with what should be done for hepatitis B, I know it's going to be a challenge because remember, COVID came at a time when there has been a significant advance rather, in science. And so the human genome had been found, and people can manipulate DNA, RNA, and so on to develop proteins and so on. At the time that the hepatitis B was found, none of this has happened. And so you can see that there was a platform ready. If, for example, hepatitis B was found at this time, perhaps we may have had such. So it is hoped that scientists might look backwards and have some gains from what has been discovered, and then be able to use this discovery, the rapid discovery of the 21st century, in identifying drug targets, so that we would be able to, at least in our generation, find a cure for hepatitis B.
Yeah. Or from my record, I discovered that the hospitals here are overwhelmed, and even the
Indeed.
doctors, the number of patients in their catalog, in their list, are so much that sometimes they take like 3 months, 4 months, 6 months to attend to patients. And we also heard that you have a virtual doctor, an app that you created. Do you think that the app can be of help to millions of Nigerians that are begging for medical care and they are not getting because of the large number of people that are seeking for medical attention?
Thank you very much, Sunday, for this, because honestly, the frustration I had when I walked looking after patients with hepatitis in Nigeria and elsewhere has been the lack of manpower. And I also think about the journey patients make from remote villages into cities. And then when you see them, they have to source for money again to go and look for where to buy drugs and then do investigations and so on. And so I looked at that and I said, okay, now one, how do we tackle the issue of number of people, limited number of people that they see and so on? And then when they come in, how do they now marshal their resources to make sure that they put it to best use? And that was how that led me to thinking about virtual consultation. So I thought about virtual doctor. So I have my virtual doctor app, which interestingly I built by myself using very simple platforms already existing on Google. And with that app, I've been able to reach out to many people and had consultations via Zoom, and also made suggestions which they will then take back to their physicians or even their primary general practitioners with the advice that is given to these patients. Unfortunately, people are still limited because they don't know how to use the technology to access these things. And also when they do, you send them letters and still find it difficult to download and also go and interact with their doctors. There's that uncertain fear about it. Again, the payment platform was a challenge for patients as well, and so on and so forth. And that was what led me to doing some more things, such as self-help apps, where you go into the app, you discover for yourself the results of tests you've done. You are able to interpret what that test tells you and gives you a better idea of your status, so that you are then able to go ahead and say, okay, I've got this combo test. There's a hepatitis B combo tool, which is on Google Play Store. You look at that and you compare and you find, okay, I'm inactive or I'm active disease. Then that tells you you should go to a doctor or you should go and do a test. When you go to see a doctor, you are confident to chat with the doctor and say, this is my status because of this. No doctor will argue with you about that because they know that is the reality of what this disease is. You may even end up being more intelligent in some way than the person looking at you. In some instances, I'm not saying doctors are dulls, but are dullards, but at least they will know that you know what you're talking about. Recently, I released the LiveStar app, which is the liver stiffness assessment app. That app will even tell you, are you supposed to be on treatment right away or delay or so on? And if you're on treatment, is it getting better? And those are the kinds of products that I have in my quest to support the care of patients who do not have access to doctors easily to use and then be able to advise themselves on what quickly they can do and engage with doctors meaningfully. That's my kind of intervention.
Okay, Dr. Quick, thank you very much. Quickly, let me ask this, that there is this information in the public space that food contributes to the treatment, food selection, this is what you are to eat, this is what you are not to eat in order to keep fit. Do you align with this information?
I think brilliant that you brought that up as a discussion in this forum. Many people, when we were growing, were told that once you have hepatitis, you should not eat protein. Very ridiculous. The reality is that the teachings and all those thoughts were based on fallacy and wrong science. Evidence has it that if you stop eating protein, what will happen is that you're actually going to break down your muscle protein to produce the essential day-to-day running of your system. Our body is constantly breaking down and being renewed. And the building blocks for our body are the proteins. And if you avoid them, then you're going to waste your muscle to produce the protein that you need for your daily running. And so you need calorie, but you also need protein. So avoiding protein is a wrong approach. It is no longer the game when it comes to taking care of yourself in terms of health. Making sure that you're eating a balanced diet. And there are many sources of this balanced diet. One of my products that I have running there is best diet advice for patients with hepatitis and or liver diseases. And that also contains a lot of useful information, especially for our community, where patients do not have access to real information about this. And so, yes, balanced diet. Now, let's talk about multivitamins that people tend to spend a lot of money in. I am of the opinion that if you can access and buy good sources of food items in a balanced sense, please do that as a priority rather than going to waste your money to buy simple drugs, because those drugs you're taking are actually going to be requiring food to work on them. And if you're not eating the right food, what is the multivitamin going to do? It's just going to give you vitamins, but not the kind of essential proteins you need for your system. So it's important to pay attention to eating good meal, take care of your body, sleep well, rest well, and thereafter you boost your immune system to actually fight the virus better that way than starving yourself and then succumbing to the long-term effects of the virus.
Okay. Okay, I think one more last question to go now.
Okay.
Okay. What of drinks? You talk of food, drinks, like that. What are they supposed to avoid? Just quickly.
Perfect. Quickly, yeah, in quick terms, the alcohol is a no-go. Alcohol is a no-go. If a patient with hepatitis B is drinking alcohol, it's like you are actually pouring gas or petrol on a burning flame. So the liver is already inflamed and you're drinking on top of it, that will quickly damage the liver. So alcohol is a no-go, but adequate amount of fluid intake is a very good thing for any person. So avoid alcohol, even in its minutest forms. It is not something that we can say take in small amounts. It doesn't go like that, because once it is inflamed, anything that would be taken to burden the liver would actually worsen the outcomes for the patient. And in particular, the particular alcohol that is produced in iron pots, burukutu or so on, a lot of these can release iron into the pots and the stored products. And these are quickly absorbed and they go into the liver to damage the liver further. So not only is alcohol causing direct damage, but even the contents and the broken down products within the local brew is of worse outcomes in patients who have hepatitis B. So I think that's my my submission to looking at patients who actually indulge in drinking alcohol.
Okay, maybe general advice to the
I think in general,
us, or maybe let me just ask this question. After that, then would you, if you are invited to Nigeria to help in any way to create this awareness, will you oblige your service?
Obviously, we're doing a lot of virtual things nowadays.
Maybe train. Yeah, maybe
Yeah, we're doing a lot of virtual
some
things
of the
here,
doctors
but of course, I can't rule out the fact
and
that if you invite me to come and you give me a platform to be able to speak to a big population that will definitely would benefit them, why not? I think we live because of Worthy Works. That's why my company is Worthy Works Medical Education. With anything that one can do to support the fight against liver cancer will be upheld by me. I do that every day. I do that even before calling you. I was actually making an app that would deal with fatty liver disease and so on. And so I'm always looking at avenues and opportunities to speak. I have actually spent my resources, traveled to meet with the Ministry of Health sometime towards the end of 2019, and where I was given an audience where I talked and discussed with the team about my desire and passion, and that which led to the production of Hepatitis Nigeria Network app, which is available. In that app, it tells you which hospitals has specialists and how you can actually contact them. And also it gives you ideas about where there's authentic care and where there is none, and so on and so forth. So there's lots of my passion in this area, and I'm happy. I've done some work for the government of Rwanda, where I produced the products for them to train their staff, the whole of the nation of Rwanda via the World Health Organization. I'm still in links with lots of my colleagues at the World Health Organization about hepatitis. And so a lot of the things that are going to evolve over the next few months or years will have a lot of impact from my collaboration with the World Health Organization and the African state, as well as the global level, how we can actually tackle this menace of hepatitis B. Thank you very much. I will definitely be available to support in that regard.
Okay, thank you very much. Do you have books that you can send to us to read also to equip
yes, so
our
I've
library?
got ebooks. I have got ebooks.
Okay.
I do know that a lot of the people back in Nigeria would like to have hard books. I am in the process. I really do need a collaborator, and I'm sure you know how to do that. You have an online magazine, so you will you might know how to contact some people who can do some print media, and then the challenge will be to place those books in the hands of those that need them. And so I am looking at taking down those ebooks into hard books, hard copies, so that people can access. And yes, so there are products on my website which people can get.
Thank you very much for your time and this informative section.
I'm very grateful, Sunday, for your intake, and I'm very happy that you gave me this interview. It's not easy, but I think this is one of the products of collaboration, which as part of 2021, I came out on LinkedIn, which is where we met, and you really yielded to the challenge to join me. and so that we can actually collaborate. And I think that what you're doing with your online media is also